Hi, I'm going to recreate a talk I gave on a panel in Boston last week at the AMIA Health Informatics Conference. It was on the subject of responsible AI in healthcare, and my job on the panel was to talk about the consumer's perspective. As you'll see, there are things we're doing as we figure out how are we going to use healthcare, and especially be careful to do it responsibly, where I think we're overlooking what has often been described as the most underlooked resource in healthcare, the patient, because we're using AI too, and nobody's talking about it. Here's a little of my background and things I'm involved in. I had nothing to disclose in the way of conflict of interest. Now, here is a graphic I found on the website of the legendary venture capitalist Andreessen Horowitz in Silicon Valley, where they mapped out the space of medical AI uses. And there's really a good collection here. And as you can see in the title, they use the Clayton Christensen concept of what jobs need to be done in healthcare. And I indicated a few of them. They used an XY axis approach here. At the top is clinical, things like scribing, recording visits. And down at the bottom is non-clinical, things like scheduling. From left to right is professional facing on the right, things like clinical decision support, and over on the left there's things that are consumer facing. Now I looked at this and I thought, what's wrong with this picture here? Because my people, me, myself, and the people I talk to in the patient advocate space, we live in that big white area to the left of consumer facing. And when we look at this, what we see is all the stuff that all y'all are doing over there in the hospital, in the insurance company, in the government and everything. That's all legitimate. But guess what? We've got a lot of stuff going out here too. And I'm going to explain a little bit about that. The problem is, it's not in the picture. People aren't thinking about it. And when you've got a blind spot like that, you cannot make the best possible decisions. So here's what we want you to know. And the super advocate, Grace Cordovano, who was not there at that particular event, I'm recording this on March 25th, and just 1 month earlier, February 25th, we were in a group call, and she said, people need to realize patients are end users of AI. So we've got to be included in governance, policy decisions, and so on. What you need to think about is that healthcare in reality is a collaboration. And if you've ever been a sick person or assisting somebody who's sick, trying to coordinate care, trying to deal with insurance companies and everything, you know, as the subtitle at the top says, we both have work to do. I'm a co-founder with my primary physician, Danny Sands, of the Society for Participatory Medicine, where we do the work together. And this is an emblem that since about 2009 has been the sort of a symbol of what we're talking about. No good healthcare event or project or anything can reach its potential if patients aren't included. And in particular, in this case, AI in healthcare, our needs and priorities may be different from industries. It will be a blind spot if you don't include us in the work. In fact, just since that discussion that Grace was in a month ago, we've identified at least these 5 different use cases, and I'm going to give you a glimpse of each one. I've been blogging these on LinkedIn and on my website, epatientdave.com. Here's one that you may have seen in the news. It was last September. This was on today.com, the website of the Today Show. This kid had been to 17 doctors over 3 years for a diagnosis. The family wasn't ditching doctors, but they hadn't found a diagnosis. Mom sat down with a computer, typed in all the information, and found the diagnosis. This was such hot stuff, and it worked, by the way. This was such hot stuff that Eric Topol, the legendary doctor, when he did a TED Talk last fall about AI in medicine, he mentioned this kid's case. And it wasn't just this one. He mentioned another one also that had been wrongly diagnosed as long COVID. when it gets to the point where Eric Topol is saying there's something important going on here, pay attention, folks. All right. The second case is much less profound. I'm an avid user of Open Notes, which is the social movement and now federal policy where we get to look at all our doctor's notes. Well, you know what I found after several years of doing this, I came to realize that it was drudgery to dig through all those notes and find what I needed to do. So I was being not as good a patient as I could be. And then I had this, wow, I could have had a V8 moment. That's an old TV commercial for those of you who don't know that. And I sat down and I asked it to look at this visit note and summarize it and pull out the useful stuff for me. How is that, right? And it said, sure, go for it. So I pasted it all in here. And look what it did. It took some practice adjusting my wording until it gave me exactly what I wanted. But of the 5 current problems my doctor and I are working on, it gave me a summary on what my actions items are. It makes it, when I do this work, when we ask the computer to do this work, it makes it easier to be an effective patient in participatory medicine. I love it. Here's a third one. This is a friend of mine. This is just a stock photo. It's not actually him. Serious blood pressure problem. It just won't behave itself. And he's concerned about that. I mean, he doesn't want to have a cardiovascular event, right? So reading up on everything he could, he thought, should we try ambulatory blood pressure monitoring, ABPM, where you wear this machine around all day? The physician assistant at his medical practice was not familiar with it. So what did he do? He sat care plays out. Hugo Campos is a legendary engaged patient. He's a graphic artist in Oakland, California. That's his medical background. He has this condition called HCM, hypertrophic cardiomyopathy. His heart might kill him at any time, so he is highly motivated to do the best he can. And now, as he's aged, he needs new blood pressure medications. At the time I talked to him about this last summer, everybody was worried that LLMs will hallucinate and patients were going to hurt themselves. He laughed. He said, Dave, I don't use them to give me answers. I use them to help me think. All right. Now, by coincidence, this is exactly what a doctor had said in a session earlier that day at the conference regarding clinical decision support software. I don't use it to give me the answer, he said. I use it to help me think out the options. See what I mean? We've got work to do too, and we're using AI to do it. Then he's a member of the famous All of Us research project that's running nationwide, and he gave a presentation to them last summer about how he was using it to help his own case management. He said, please compare the inotropic and chronotropic effects of verapamil and diltiazem on the human heart. And just his most recent thing he shared with me the other day is that he has now uploaded 110 megabytes of PDFs of his medical records that he downloaded from his different providers, and he's having extended conversations with GPT, and Claude is another one, and the new one that he was raving about this morning is Perplexity, right? Highly engaged patient. And then now the next use case is when you've got something you're trying to understand some issue. It might be something in your medical chart, it might be something in research papers, and it's over your head. You can paste that stuff in to an LLM and ask it to summarize, so that it brings the information to the level that with it. Okay. So returning to the Andreessen Horowitz graph here, all the stuff on the right is real and legitimate, but there's a lot going on out here too. We need AI and we use it. So please include patient use cases in your thinking about the space of AI in healthcare. The opportunity is to extend the patients included movement into this space as well. And the point on the right here is essential. I've worked before cancer, before I got into healthcare advocacy. I worked in marketing and industry. Our needs and priorities and our job to be done are the same and sometimes different from industries. So include patient users. Thanks so much for your time.